Black Americans are or tend to be overdiagnosed with schizophrenia up to 2.5 times more likely, and sometimes even up to 3 to 4 times more likely. Black Americans have different and some unique risk factors that are not common in the majority population, specifically as it relates to systemic racism and things that perpetuate that, such as poverty, living in environments where there might be prone to witnessing violence, not having access to appropriate and adequate health care, hesitancy to disclose symptoms to caregivers. That could be due to their mistrust in the medical system. It could be also due to the fact that there's not a workforce in mental health that is diverse from an ethnic standpoint or a cultural standpoint. And all of these things make it difficult for some patients to be able to talk freely. There's also sometimes a lack of cultural competence and sensitivity as it relates to healthcare workers. And so someone might overrepresent or overemphasize symptoms that someone is reporting, or maybe even think of something as a symptom that might not be a symptom. So for instance, if you're living in a neighborhood that is unsafe, that there's a lot of violence, and you speak to the fact that you're nervous, you're afraid, someone who's not culturally competent or culturally sensitive might attribute that as something that is paranoia as opposed to something that is just their real life experience. If you're someone who is genetically vulnerable, meaning that you have a family history of schizophrenia, there are things that you can do to decrease your risk. For instance, you can decrease the amount of stress that you're under, you can engage in better stress management and coping skills. Also, refraining from substances and alcohol can greatly reduce the risk. If you think you or a loved one may be misdiagnosed with schizophrenia, I would say the first step would be to have a conversation with the person who you believe misdiagnosed you. And if ultimately you still feel strongly that this was a misdiagnosis, you should get a second opinion. It's really important that you feel comfortable and confident with the diagnosis, because that's the best chance that someone will have to adhere consistently. And we know that consistent adherence to a treatment plan gives the best outcomes.